tested, but they said don't get tested without showing one of the symptoms.
Okay,
it's recording.
folks, we are, just so you know, we are recording. We'll be able to clip the presentation chatter, so please continue if you want with the banter. But if anybody has a objection to that, just let me know right now.
No, that's great, and that's super. Well, Jonathan, I hope the quarantine doesn't last very long. You have no symptoms?
I'm okay. I'm fine.
Okay.
Good.
Okay.
Good.
But just in case.
Well, you know, the just in case is a really good thing to do. I think a cautionary way of approaching this is very good for all of us. Most definitely. So.
All right, it's 10 past, so I think we better just go for it.
Sounds great. Thank you. Thank you, Steve.
So, evening, folks. This is our initial presentation of COVID in industry, a discussion of how to get back to work. Thank you very much to the New York Chamber of Commerce for providing me this platform. My name is Zahir Ali. I'm with Axia Global, and we are a bespoke AI and Industry 4.0 solutions company. What I'm going to be talking about today is how can we understand what's going on in the world in our little microcosm of the world, our industries, our companies, our enterprises, and offering some discussion about how to think about moving forward with that. We'll first go through some discussion of what the risk and what the safety measures and risk involved are. We don't want to be the Tesla plant, which has had 130 transmissions since reopening, but we also don't want to be like a variety of other industries we see that are paralyzed out of fear, and that's not useful in any stretch of the imagination. We have to move forward, and hopefully the discussion provided here will enable people to do that. If I can advance the slide. There we are. So I like to always start with a thought, and this is from Seneca, from Letters of a Stoic, senator of Rome, and he wrote, "Fate leads the willing and drags along the reluctant." We've seen this in our world in many ways, typically with technology, but in the last 6 months, we've seen it with COVID. There are people who are prospering during this time. Netflix and Hulu, Instacart, basically every delivery-based service is going gangbusters. Then there are folks that are neutral, and then there are folks that are just feeling a bit wiped out right now. But what we have to do is be willing to work with what fate is leading us through and find ways to be the best that we can be within that. So, coronavirus. You know, some of us are reacting a little aggressively with a little bit of paranoia. But the fundamental statement that if you take nothing else away from this discussion, it's keep calm and carry on. Yes, there is a concern. Yes, it is risk. Yes, there are a lot of people who are in a bad way. But we can do very simple things to make sure that our work environments are safe for ourselves and our employees, and to enable the economy of our own enterprises and, frankly, the country to move forward. So when you think about the general COVID-19 safety framework, what the heck are we talking about? So there are certain things to do. There's at the base of the pyramid, it is minimizing exposure to possible carriers, i.e. sheltering in place. Now that's not really that effective for a lot of reasons, because you can't really go to work if you have to go to work physically. But there are things that you can do, yes, as your proximity and therefore exposure risk increase, you can also increase protective measures. Now, in the first 2-3 months, there were massive shortages in supplies. You couldn't get N95 masks. You couldn't get even 70% alcohol. All of that has changed. It's the last time the world saw an effort like this was probably World War II, where industry and manufacturing switched over dramatically to support a global effort in one particular direction. One moment, please. I have to address the feather. So as we think about this, we start with minimizing exposure. Then we go to social distancing when amongst people and practicing home hygiene. These are what we would call weak and procedural mitigations. They're not enforceable. They're based on trust. This is social contract, you know, Rousseau and all that. And people are violating this. But at the same time, we have to be cognizant that we can have a lot of this in our control. Next, what you go to are what you would call strong procedural mitigations. So at work, you can enforce distance, you can enforce mask wearing, you can clean as you go. And then finally, you have what we would call engineering mitigations. These are devices or systems that specifically are engineered to help you be safe. That's N95 masks and eye coverings. These are in your personal control. So whether or not an office mandates it or not, we each have control over the vast majority of this pyramid, actually. And we can save ourselves. So we don't have to be paralyzed. We don't have to say, you know, if I go outside, I'm going to get this disease. We can handle it by taking our own measures. So when as an employer, as a business, how do you become safe at work? Well, you think in layers. It's very similar to layers of security or to layers of radiation protection, if you're familiar with that type of work. But I just think of it as an onion. You have the general populace, and when there are no precautions, there's a 1/3 chance of being infected if you interact with a carrier. Now, when you do things like limit attendance to work, that reduces exposure to carriers. That's one layer. The next layer would be teams and area personnel limits. That further reduces your risk. Then you can implement cleaning and hygiene. Finally, there's distancing, and then PPE as possible or necessary. That's personal protective equipment. So what can you do to keep employees safe? There are a few things that we need to do right away. You need to limit workplace attendance as much as possible, stagger on-site and work from home days. So what this is that, for example, there are a variety of software firms in the Bay Area that are saying that have looked at their cubicle and seating charts and have basically said that gone 1-2-1-2, meaning every other person in that seating chart comes in on Monday, then the other person can come in on Tuesday, and so on and so forth. Now, they don't have to come in depending on what their work is, but those are their option to be at work days, specifically to create a staggering and limitations about how many people are on site. Another thing to do is to change to multi-shift operations. This is going to be particularly important for manufacturing and industrial operations. So by moving from having your whole staff there during the typical workday, if you can move to a 3-shift operation, while that is inconvenient, you can create social distancing and actually continue production while being safe. Then, of course, enacting clean as you go policies and providing cleaning supplies. So these are things that are very simple: alcohol, soaked wipes, different types of disinfectants, and sanitization. then there's adjusting forced air systems to include more fresh air. Most people who work in an office building don't realize this, but most building HVAC systems only bring in 7 to 12% of fresh air. Most of them can only be set to a maximum of 15%. It is very difficult. None of these systems bring in 100%. So working with these systems, but many of them have the ability to have filters put in. So you can actually implement HEPA filtration in your HVAC or advanced filtration, because you don't necessarily need HEPA to block coronavirus, but you just need the right sized filter. And you can adjust it so that there's more fresh air. Providing personal protective equipment, this is something that is beyond the cloth mask. So this is going to either a KN95 or an N95. KN95s are very available in the market. They're better than cloth masks. They may not be as good as N95 masks, but they're only 50% as expensive as a reusable mask at this time. And then creating physical barriers where possible. These are different types of cubicle guards, and this is a way we can collaborate with different industries. So, so contractors, handymen, or different types of industrial workshops could easily modify the work they're doing to work with different types of industries such as retail, restaurant, and office to create physical barriers for those industries and provide that as a service and a product. And then finally, encouraging COVID-19 testing and provide if and when possible. So at least locally right now, there's a lot of free testing that's available, and keeping employees apprised of where those opportunities are, when they are, and even possibly providing them a break in their workday to go get that done can be very valuable because it saves you and saves your liability. Then what actions can we take to keep customers safe? One of the key things is training on awareness, and also implementing processes to limit transmissions. So this goes to everything from training your employees on how to wear PPE correctly, what the right etiquette with gloves is, what is the right time to wash your hands versus sanitize, versus using an alcohol wipe on something versus a spray, and what the best outcome and what the best methods are. It's actually very valuable. It's not valuable to throw a bunch of gloves at people and say, wear these gloves. They don't know when to wear them. They don't know how to take them off, how to put them on. What is the optimal change out time? Same thing with masks. Same thing with a lot of different types of personal protective equipment. So that training is critical, and there's a lot of free resources available on that through the OSHA website. So those are available, paid for by your tax dollars. So it's really important to use them. Then, of course, adjusting the forced air systems, which we've already discussed, providing personal protective equipment. It's really interesting. There are restaurants, these are a little higher end, but when you walk in, they provide you opening in front of you packets of personal protective equipment to use. So you can verify that this is a fresh thing. They're not relying on people to remember to bring them. They're not relying on people to have these things on their own. They're saying, we're going to give you something disposable. And they're charging for it. There is an added cost, and they are passing that on to the customer. However, right now, people are so in need of social interaction, so in need of the ability to go out and have some normalcy in their lives, that by and large, a lot of people, at least in California, Bay Area, LA, San Diego, are willing to pay for that. It's part of the service. So having that available, finding a supply chain for that, and providing it to your customers so that they don't have to worry about it, is a value added. Then creating physical barriers where possible. So this is a little different than the industrial case, where we're talking about cubicles or spacing out machines in a machine shop, or stations on an assembly line. And this is where we've seen some young entrepreneurs. It's actually very interesting. I know of a couple of young entrepreneurs in India who have an industrial glass business, and they've pivoted very aggressively into providing barriers for offices, banks, retail, and restaurant, by creating different types of glass structures, whether it's on a table in front of people, between people, for example, at a bank teller, or these beautifully elegant glass structures with wheels on them that get rolled up at tables in restaurants, so that customers at a restaurant can feel secure. Yes, we are becoming a bit of a bubble culture, but one hopes that this will recede in time. However, at the moment, having that capability is enabling businesses to stay open, and working with local industry to provide such solutions can really help. Then, of course, cleaning frequently and using gloves on externally bound products or materials. So this is something that you're seeing a lot in takeout right now. People are using gloves all around a restaurant when they're handling takeout. And now the guy tossing the pizza dough in the back probably needs to touch it. So that's a little bit of a challenge, but a lot of helping keep customers safe and bringing them in is not just about what is actually effective, it's also about the optics. And the optics of gloves and handling of externally bound materials is really critical. And we're seeing that businesses that have people go back, whereas businesses that have people being seen as handling these things without any care are receiving complaints. There was an interesting article recently about about some of the number one complaint on Grubhub and Uber Eats recently. And the number one was, of course, food was late. Well, it's a little challenging right now. But number 2 and 3 were actually more interesting. They were about the handling, where somebody said, oh, my driver called me because they couldn't find the address, and they handed it to me out of the window, and they didn't have anything on. They didn't have a mask, they didn't have gloves or anything. So that made people less likely to order that Uber Eats again. So those types of, even though they're not thinking like, was the cook wearing gloves? Was the cook wearing a face mask? I personally would be more concerned about that. However, what people are seeing is the tip of the spear, and that's what they're remembering. So keeping that in mind about the optics of it is really critical as well. So let's think about assessing risk. One of the things to remember is that life is inherently risky. I love this quote. There's only one big risk you should avoid at all costs, and that's the risk of doing nothing. And that's what some people are doing right now. And that's going to be a problem for them. So let's not do nothing. Let's take action. So what are the infection risks on the way to work? And this is kind of a modification of in project management. We have something we call a fishbone chart, and this is kind of a modification of that as a risk vector chart. So you've got, if you're working, you may be traveling. You've got all these risks. You've got a rental car, hotel interactions, airports, commercial. At home, you could have kids at daycare. You've got family members. You may have visitors, friends and family who you feel comfortable with, but they have other people they feel comfortable with who have other people they feel comfortable with, and so on and so forth. That's the network effect. It's exponential. You have errands you run, with the miscellany, medical care, laundry. Of course, food is a big one, whether it's delivery or eating out, social gatherings, and then you have the infamous unknown unknowns. So one can look at this and say, well, I guess I can't do anything. That's exactly the wrong conclusion to arrive at. The point of this is really to say that you have all these risks. What can you, at each of them, think about? What can I eliminate? What is my real risk at each of these points? Is it really high, or is it or is it statistically low? And what can I do to minimize it? You know, whether it's just wearing a mask when you're going grocery shopping, whether it's not, you know, sharing the same glass of wine with your friend at the barbecue. These are really simple things. So it's a little bit of a culture change, but we can minimize this. So moving forward, now I'm going to do a little bit of math. What is the probability of someone having COVID-19 at work? So assuming that in general, a patient is contagious for 14 days. And so these little numbers here, they mean the citations. I've got a whole set of citations at the back end of the presentation that hopefully are of interest to people. I've done the reading for you. If you want to go read that, go ahead. But believe me, you'll be asleep before you know it. So in California, between the end of May and the middle of June, there were 40-ish thousand new cases and 972 deaths. Now, working through that, using the total deaths versus cases, you get a death rate of 0.03, so about 3%. Now, when you look at multiplying that by the number of deaths we saw, you get kind of a nominal amount of 28,000 contagious cases in California. That's on the order of magnitude as 40,000. So we'll take the conservative one. We'll go with 40,000 in that 14-day span, assuming that there are 40,000 contagious cases in California, and the population is 40 million, roughly. We get a likelihood that a person is contagious of about 1 in 1,000. So this is nominally the individual risk we all face. That's 1 in 1,000 people we encounter when we walk out the door that we contagious. Now, there are fluctuations across the state. Right now, LA's popping a little bit. Bay Area's doing pretty well, actually. The infections, these things are a little contained in certain areas. And then say that we nominally have 20 employees. Take a small business, a machine shop or a restaurant. So we get about 2 in 1 second, honey. No, we get to about 2 in 100, and so that puts us. This is kind of the risk that you, as a restaurant owner or a small business owner, face. Then continuing on with the math, right? Based on the transmission of 1 in 3 people without any mitigations, the chance of infection is 7 in 1,000. So that's the likelihood of transmission within your team. Now let's look at the probability of infection, assuming that people have reasonable hygiene, they're not taking crazy risks away from work. There are going to be mitigations at work, but an infected person has arrived on site. So we start with no mitigations. In the absence of policy, early infection rates grew at 34% per day. So we assume a 34% rate of infection. That's, since these papers were published, that's really been proved out. So there's a lot more literature besides the 2 references behind that. Now, what it turns out is that simply by limiting attendance at work and implementing area personal limits and social distancing, you get a 98% reduction. That's gigantic. So if you run a factory, by going to 3-shift operations, by getting people, by reducing your staff to only the people who are producing your product, all right? If you have accountants, you have office managers, all those people can work from home. And then putting in some social distancing amongst that team, you get down to a fraction of a percent already. That's assuming somebody in that population, somebody is infected and contagious. Then you implement clean as you go and hygiene practices, you get down to a further 24% reduction. So that's 0.34 to 0.26. So this set right here should be standard practice.
Hmm.
There's really no business that can't implement that. Now, if you need to, you can implement N95 masks and face shields. And these are the precautions that healthcare workers would have, for example. It's not clear to me or clear in the literature that even people interacting frequently with populations like grocery store clerks need these precautions, because physical barriers can be put in place, as I think there are now in a lot of grocery stores, for example. And then assuming there's poor compliance, let's backtrack a little bit. Let's say people are not doing so well with everything, right? The realistic average is probably about 0.1%. If someone is present, the probability is still very low that you're going to get a transmission, right? That's 1 in 1,000. So what does this roll up to? How do we think about this as an aggregate? What's the total risk? Well, how likely am I to get infected? First, calculate how likely is an infected person to be at work. So that would be the probability of a carrier on site. Then calculate the chance you will get infected if an infected person was at work. Now, I actually, for the sake of this calculation, I degraded the calculation a little bit, assuming that people weren't going to comply with everything. I mean, people are people, right?
Mm-hmm.
So we take it up to, instead of 0.1%, 0.3%, right? I literally multiplied the risk by a factor of 3. So that's the probability of an infection being transmitted. So kind of the typical probability of an infection, you getting an infection nominally is 3 in 10,000. Now we might have some multiplying factors based off of, say you're a restaurant worker and you interact with 100 people in the day. So even if you multiply that by 100, you're still at 3 in 1,000. So that's kind of how you want to think about the risk. The reality is that this should not be paralyzing industry. This is manageable. This is better than simply taking a 100-mile drive, right? That's your typical risk. That's on the order of your risk of getting in a car accident. So that's where we are. It's not to say that this is not real. It's not to say we shouldn't be aggressive about dealing with it. It's to say that we shouldn't be paralyzed, but rather take the right steps to deal with it. So looking at the overall reality, we cannot drive the risk to 0 probability, but the sky is not falling. The primary risks are the same as during shelter in place, grocery errands, etc. And what we can think about is the most effective methods of containment are cleaning and PPE. So supervisors need to enforce that. There will be risks, for example, during flights, for example, if people need to travel during work, that can be directly mitigated by N95 mask usage. This is a bullet point that I missed that I need to remove. But in the end, testing is something that, you know, I have a kind of an appendix where I talk about testing, but it's not a silver bullet. People are talking about testing as if it is a silver bullet. It's not. The reality is that a positive test is about 80% accurate, but a negative test, meaning you test as not having the virus, is only 50% accurate. That means half the people who have negative tests actually do have the virus. So we can't think that, oh, we're going to test everybody and it's somehow magically going to be like a little you know, blinking light on top of their heads that, okay, that's the person that we can't have at work and these are the people we can. That's not how this works. All of this is based on probability. So before we move on, I kind of wanted to pause briefly to take, you know, since that's basically the first half, to take any questions about the discussion of risk.
So here I have questions. This is Anne.
Yes, please.
If the accuracy rate of a negative test is about 50%, and if I've heard that some companies are requiring that a person who may be exposed or who may have symptoms has to test before they come back to the workplace. In one case, I heard a company saying they would require 2 tests a day, in other words, a test a day apart before, and both of them coming out negative. That obviously, I think that would increase your accuracy to 75 rather than 50.
That's right. You did probably right. So yeah, yes, people are trying to do that. Some places are trying to do 3 tests, but the reality is, when you look at the medical literature, that even if they go based off the test, the CDC is just recommending stay at home for 14 days. And the reason for that is that because you typically are moving beyond the contagious period. So when we think about this, it's not about managing who has the virus. It's about managing people who are contagious.
Yes.
And that's, for example, we've had a small incident where I work, and what we were looking at is somebody who has symptoms. We don't have a positive test, but somebody who has symptoms was interacting with people, and then those people interacted with other people, and a bunch of these folks are shocked that we're telling them, look, don't worry about it. And they're saying, well, but I was interacting with somebody who was interacting with somebody else. And the answer is yes. But the people who interacted with the symptomatic person, who are primary contacts, and then you interacted with the primary contact that same day, that person could not biologically be contagious at that point.
Right.
So your risk is almost your risk is 1 in millions, right? So these are some of these misconceptions about how the virus works that are adding to this fear factor about running a business, about running an operation, and that's the part of the point of this discussion, is that knowledge is power, and what if something does happen, the simple thing of just saying, hey, we're going to take a day, nobody's going to come in tomorrow, we're whatever that consequences are, we're just going to take that day, we're going to do the contact tracing in that day, and then we'll know everybody, and then everybody else can just come back to work. And it's very simple. It's super clean. Taking a beat. That's all it takes. Hopefully that answers your question.
Yes. And I have some other questions that don't deal directly with the risk portion of your presentation. So if there are other risk questions, I want to wait until those are addressed.
I'm not sure, this is Valerie, and I'm not sure I have a question more than a comment. Clarifying that in the way you just did is very interesting to me, because you said it in the way most people understand, addressing the fear factor. And there is such an uncertainty and fear factor in most people that if they have had a momentary interaction with someone, very short, not as my daughter who's a ER nurse would say, an overload of viral activity, you're panicked all of a sudden thinking, oh my gosh, I spoke to this one person, or I spent 2 minutes or 3 minutes in conversation or whatever. And I don't know, I'm just sitting here thinking that this is good information. This is very, very good information.
Right. So if you think about how long you typically would spend at a bank teller or at a grocery check stand, even if that person was infected, it's just unlikely that you're going to have a transmission in less than a couple minutes. And then you add the fact that most places now, people are wearing masks, people are implementing some physical barriers, they take those likelihoods down by a factor of 10 each one, each time. And so again, it's about putting in together the simple things, but really it's just a concept of a culture of let's remove the fear, let's focus on the facts, and let's do the right things. Right, the people who are it's really amazing to see these videos of people packed shoulder to shoulder in a swimming pool, for example. Right, that's like, no, that's not good either. But then you also see these photos of people who look like Bubble Boy, and that's not really the right concept either. The answer is to do the right things, to have some logic about it, to work, focus on what the science says, and then move forward rationally.
Okay, thank you.
But to not be paralyzed.
Thank you.
So I think I'll jump into the second half now. I think I'm doing pretty well on time.
Can I ask a couple questions from the first part, though?
Yes, yes, of
before
course.
you go, with regard to the HVAC information and the gradations of fresh air being introduced into that system.
Mm-hmm.
How, in your thinking, does that relate to cube barriers in an office situation or restaurant barriers that you described? How do you balance those forces of barriers versus air circulation?
So air circulation is bad.
Mm-hmm.
Circulation leads to, if it's in one area, it goes to another. Having new air come in and old air pushed out is good. So we have to separate the way we think about this a little bit. So for a restaurant, right, that's why outdoor seating is so powerful. Right, because you have infinite fresh air, and outdoor seating by the bay is the best for a variety of reasons. But in the case of COVID, simply because you have a constant breeze, typically.
Yes.
So one of the things people can think about is, can you create a monodirectional airflow? Line up 4 fans against one wall.
Oh.
And blow air only in one direction. And ideally, it's against the back wall, and then you leave the doors open, you blow it out.
Understood.
Now, and Fremont doesn't get hot enough to worry about, frankly. Maybe a couple days in the year, but we're not really stressed about air conditioning. It's not like Los Angeles, where I used to be, Santa Clarita. You have 30 days at 100 degrees nowadays, or these years, and so that's less appealing. But there's a cost during times like this to recirculating that cold air.
Right.
There are other things that are more expensive people can implement. UV has been clearly shown to deactivate. So implementing aggressive UV lamps at the air vents. But again, these can be expensive. These can be expensive. That's something that a factory could do, but one would not expect a retail, a small shop, or a restaurateur, or a small service provider like a nail salon or a barber shop to be able to implement.
Mm-hmm.
Just because of the cost and possible technical complexity. But
my last question has to do with, go ahead.
No, I was just going to say, a lot of this comes down to Occam's razor. Often the simple answer is the right one.
You talked about a certain kind of mask that was half the cost of the N95, I believe.
Yes.
Was that the K? Tell me again what that was.
Yes,
please.
KN95.
Okay.
And what's happening is that a variety of American companies have very quickly transitioned to manufacture them. It's very interesting. These are typically upholstery and other textile manufacturers. And so I have a few contacts actually from the LA area where these are American companies that transitioned very quickly and started supplying these to hospitals. Part of the challenge is that they're not certified by NIOSH, but for most people's applications, you don't need that certification. And the fact that maybe they're not as good as N95s, maybe they're 80% as effective, still buys you a heck of a lot. And you know, they're a couple dollars a mask, and they're usable for 400 to 1,200 hours.
Oh.
Whereas N95s are on the order of $10 right now per mask, and the good ones can be used for 1,200 hours, but those are often more expensive. Those are 15 to 20, some of them. The cheaper ones at 10 are often only rated to 400 hours. And there's a lot of detail about that. And if our industry members want detail discussions, I can provide it about valve versus valveless masks and things like that. There's quite a bit there to get into. So the next half is going to kind of be a little more action oriented. What can businesses do? So 1 second, pardon me.
You have a little background music.
She doesn't accept that this evening Papa is distracted. This is one of my favorite quotes. It's basically inscribed in the inside of my eyelids. It's Marcus Aurelius from Meditations. The impediment to action advances the action. What stands in the way becomes the way. And it is, and that's really kind of what we have to think about in terms of COVID right now, because crises are rife with opportunity for those who are willing to see and grab them. And that's really what people need to think about to move forward. The other part of that is, though, that either you adapt or you die. It's really simple. It's Darwinian out there. So there are three key things to think about right now. The first one is rethinking your enterprise resource allocation, reprioritizing your work, and asking the question, what can digital do for you?
Okay.
So I'm going to address each of these in turn. So rethinking your enterprise resource allocation. So this is human capital and also equipment, as well as other resources. So first of all, can you go off-site? Can you go on-site with distance? Where do you have to be on-site but work in close proximity? And how can you use multi-shifts or shift phasing to keep your company operating? This could have some effect on fixed cost. For example, keeping the lights on in a warehouse for 16 more hours a day than you typically would. Mm-hmm. So there could be some associated challenges with this. Talking to your workforce about going to multi-shift operations or going to every other day operations for half the team. But people will also have to realize that this is what's going to keep the business going. These are tough choices, but clear communication about the reasons and how to move forward can really help create buy-in. Because it's not just about keeping the business going, it's about keeping the business going while keeping people safe. Mm-hmm. So that's why it has to be done. The key thing is triaging who gets moved on site. A lot of businesses I've heard, well, we're just going to move everybody on site and figure out how to do that. And they're not thinking about what roles can effectively be moved off site and how to prioritize that. Everything soft, everything done on a computer should stay at mandatory work from home. Your accountants, your administrative assistants, those types of folks do not need to be on site. If there is a modest investment necessary to enable them to work from home, it's probably worth it. That will give you an immediate reduction in risk because you're reducing staff on site. Then on site and distance, what can be done in terms of distancing people? What can be done in terms of PPE where people have to work close? And then again, going back to the multi-shift concept. But these two are really of critical discussion and thought for a lot of small businesses because it's challenging. The office simply may not be big enough to allow social distance. So you have to bump down to multi-shift. Or people, you're only one deep, there's no bench, everybody who's there needs to do a specific job. So how do you stagger? But putting in the right type of PPE, personal protective equipment, can really help. And there's a variety of ways to rethink that. So that'll vary business to business. And as we move forward with the chamber, if people want to kind of have a custom discussion, we can figure out how to make that happen through Axia or otherwise. The next thing is to reprioritize your work. So this is triage. And then those of you who have ever worked or volunteered in a hospital or fire department are familiar with the different colors of tape. And you'll put them around an area. There'll be the people who you deal with immediately, the people who you can wait on, the people who've got the cuts and bruises, and then the people who are, it's kind of rough, but you've got both the dead and the certain to die. And so when we think about how we're working to protect the revenue and the top line of for the company, because there are, the way we have to think about this is first we have to protect our top line. There's no bottom line without the top line of the balance sheet. So you have to protect your revenue before you can worry about what your bottom line profit is. And so what you need to do is you need to focus on your highest value revenue streams. How can you keep that coming in? Because there's a lot that can be done to make sure that there is some bottom line and that you're not running negative. But if there's nothing coming in, then you're faced with either accepting a lot of cost to somehow keep the band together or folding. So you've got to focus on your top value revenue streams and what you can do to deliver and keep those alive. The next thing to do is explore COVID-related opportunities. So this is the furniture company that pivots to making masks. This is the machine shop that pivots to making ventilator parts. Going from one big challenge a lot of machine shops have and different types of industry have is that they have a huge over-reliance on one or two customers that they've developed great relationships with over often the lifetime of the owner or founder, and that's anything from 50 to 80% of their revenue. And that's a disaster waiting to happen. So with what's going on with COVID, can you pivot to PPE? Can you pivot to equipment that's needed for the response? Can companies pivot to things that people are buying? It's a crazy thing to think about right now, but you can't buy a bicycle. Bicycles are all on back order right now. I'm a pretty keen bicyclist when I have the free time. And I was looking at picking up a road bike for my wife, and I will go into the bike shop, and he says, look, I've got no bikes. I don't have any used ones. I don't have any new ones, and I can't get anything on order. And the only thing on Amazon are rubbish knockoffs. So thinking about what industries can be approached because their supply chains are restricted overseas, right? Because there's supply chain restriction flowing into the US from overseas, we have an opportunity for local industry to supplement that, keep things going, because people are buying things. Money is being spent. What it's being spent on has changed. It reminds me of a lesson I learned from a friend who's a software engineer at a beverage distributor. And he says, people don't stop drinking. When the economy goes down, what changes is the cost per bottle that people are buying. But the volume remains the same. In fact, he said it goes up. But So it's not about, oh, nobody's spending money. It's about thinking about where is that money now being spent, and how can we tap into the back end needs of those industries.
May I mention something that just it triggered a thought for me?
Yes.
It's not like a certain industry thinking about their typical customers, their typical suppliers, everything else, and what can we continue to do while you're exploring possible related opportunities. Someone who stepped completely out of that, but took advantage of contacts where supply chain was available was, it's the only one I'm aware of, is Chamber in Southern California,
Sleepy?
who you know, we usually chambers don't do a lot of retail sales. You have to be somewhat careful, because obviously if you're selling against your your for-profit members, you're also, those are taxable sales, and so you have to consider that, at least is that you're actually competing with your members. But there's times when it's an appropriate thing, and this one chamber actually had some extraordinary contacts, and when nobody could get any of these PPEs or hand sanitizers or anything else, they basically became the go-to place because of the connections they made to be a place where they could funnel the available supplies from those manufacturers or suppliers, which I thought was really quite unique and fascinating for a nonprofit organization to figure that out.
Well, that's an example, a great example of the creativity that's needed right now. And then lastly is pivoting to continuing demand products or services. So that's things like, can you convert staff to be able to deliver things? Can you convert what your business is doing to provide services that are growing in demand? And that is another critical consideration to have right now when thinking about reprioritizing your work.
Mm-hmm.
So, whoops. So then in that set, you know, this is another very rich topic. There's kind of too much to go into in detail, but some macroscopic things to think about are how to answer the question, what can digital do for you? So considering digital micro transformations. So what does that mean? That means you don't have to transform your whole company, but can you get an app? Can you get a small, lightweight customer relations management system so that you can be constantly interacting with your existing customers and potential new customers? The other is to use gig platforms to develop digital content. So a gig platform is a platform where people can bid on, and you can assign them short-term, very finite jobs for a very nominal fee. So for example, to get an animated promotional video for a company, a 2 to 3 minute video, it can be cost only $500. And these are professional quality. So this is something that needs to be exploited by local small businesses. Apps may cost a little more, but the sheer amount of money that these small local businesses are giving to different platforms is quite a lot. So can they implement ways to have simple interfaces? Maybe a customer wants the ease of just having their credit card entered into a system like Grubhub or Uber Eats, but at the same time, if customers are local and they know what places they like locally, they may be inclined to work with that person directly. And so having that app, having that interface, having the website even just be able to do an order, because right, the reason we think of, oh, we need to have an app is because we're on the go, but we're not on the go right now. A lot of people are at home, so they can order off of a website. They can log onto the computer, put their order in, and boom, instead of paying the Uber Eats to deliver, one of your waiters now still has a job, because that's your new delivery person. right? Yes, that'll take some overhead. You'll have to figure out insurance and things like that. True, but it's another way to think about it. And then, you know, working and employing local people such as students to create web presence and apps can be very powerful. There's huge talent pools, particularly in areas like San Francisco, LA, Seattle, San Diego, in these realms that are just available and are very happy to deliver services that with more expensive firms might cost on the order of tens of thousands of dollars for thousands of dollars. So thinking about this creatively, and this is a really rich discussion. One that, again, you know, I would say that if people are interested, some of our member companies, you know, if you guys want to refer to them to me and have them, we can have those discussions to figure out how they can move forward. And then finally is, of course, something that American companies are actually kind of bad at doing, which is thinking globally and acting locally. Foreign companies do this really well, actually. It's really kind of funny. But American companies are used to having that domestic market of rich consumers. But things are flipped around right now. If America doesn't need so many KN95 masks, that doesn't mean South America doesn't.
Yeah.
There is an opportunity for different types of industries and businesses in America, in California particularly, to become exporters again, for the first time perhaps in decades, for some of these companies for the first time in their history. So what products or offerings can be leveraged out of state or internationally? Do you as an entrepreneur or as a business owner or as an enterprise owner have access to critical supply chain? What team training or other investment can you make to enable this to happen? And can you partner with local businesses to help each other or work together? And that's a really key one, is that a lot of small businesses are kind of focused on providing product to larger businesses, but don't think of how they can work together with other businesses around them very easily. They rely on the larger business to do that integration. But should they want to ship overseas, should they want to access new markets, having these smaller businesses work together to create integrated solutions can be very powerful, because they don't then have to rely on this other entity to do that for them. So their key resources, of course, the Newark Chamber of Commerce. There's I got these two links wrong, actually. There's a Center for International Trade and Development, California Center for International Trade Development, and the United States Trade Representative. And they maintain both resources on how organizations can figure out how to export. And also, they provide lists of what is interesting. So there's a lot of detail there, understanding NAICS codes, understanding import-export rules, and being able to search the databases, which are all open import-export databases, to understand what's being exported to what country and what volume, how that's trending. There's a lot of detail in there, but it's also not something that can't be understood, or something that somebody like me or some couldn't help companies figure out. It's very doable, and can open up a lot of doors, can help people think about where they can access markets sitting in little old Newark. So then I'm going to be very brief, because I want to leave some more time for questions. The question of testing for symptoms, the virus, antibodies. When we think about testing, there's a lot of things that are good. Can you check temperatures before allowing people on site or on aircraft for travel? Oral thermometers are good. followed by in-ear. Non-contact, the IR thermometers on our cameras are actually very poor. The medical community basically doesn't trust them.
Oh. Hmm.
Multiple checks throughout a day can screen some people, but they won't screen asymptomatic carriers, someone who has taken a fever reducer. Now, there's a lot of detail in this, but I'll give you the highlights. Viral tests tell you if you have a current infection. Some of the tests, probabilities of false positives are up to 40%. That was for that famous Abbott test that everybody was very excited about, 30-minute test. It's so great. It's not so great.
Mm-hmm.
But the Roche ones are 90% or better. So they're really good. That said, there are problems with the false negative rate, 20 up to 50. Then there's what's called the antibody test. This tells you if you have had the infection. Doesn't tell you anything about your current state. It doesn't tell you if you've had immunity. They have not verified that people who have antibodies have immunity yet. So it's kind of an interesting tracking tool, but it's not really useful as an employer or as an individual who's trying to figure out what my risk is. It's really a scientific tool. Ideally, it'll be really good if over time we can get enough antibodies out as a country and test everybody for the antibody, so we can see how the antibody, how infections go, and we can do science with it. But in terms of what is its value to a business owner right now, it's nothing, basically nothing. So it's something to not really pay, in my opinion, to worry about. So why should we test? Well, you can't manage what you can't measure. So testing is interesting. Only testing can screen for asymptomatic carriers, but there are a lot of these false positives. So going through this, random screening can help catch asymptomatic carriers. But again, this is not the type of thing that a small business would worry about. If you're at 2,000 employees, then it's worth it. Tesla should be doing this. Very simply, Tesla should be doing this because there are statistical methods they can involve because of the sheer numbers they have. Should a restaurant be doing this? No, absolutely not. It's not worth it. So that's really the end. I would like to just let you guys ask some questions now. We've got about 20 minutes till 7.
Wow.
Yeah, I know it's quite a lot of information.
It's good information. This is Valerie. And again, each of our situations are different, but there's a lot of information out there from a lot of sources, Z, and nobody has time to access them all, or interest even, a lot of people.
Right.
But maybe it's overwhelming. Sometimes when you see how many people are trying to provide information that's helpful, it's overwhelming. I felt like, and again, I'm not asking a question right now, I'm just commenting. My initial reaction to this is that I felt like you gave some very, very good factual information and useful information in a short period of time. That as you elaborated on your slides and what each of these points meant, I found I feel much more informed than I was. I feel like I've learned things I had no idea about. So I'm just going to comment right up front that I'm really impressed with what you managed to put into this short period of time, and add some information that I'm not sure people would pick up everywhere else. So I'm
glad you found some value in it.
I did. I did. And so again, I'm not just saying that to say, wow, good job, because it was a good job, but as an individual, I found this very, very informative.
So here, this is Anne, I second Valerie's comments, and I was also impressed with how much information there was for the executive the company owner
Mm-hmm.
to use and adapt in their own situation.
Yes.
So it's been very helpful to hear it, and it will make it easier for me to talk to other people about what they might gain from sitting in on this conversation at one of your future sessions.
Mm-hmm. Indeed. Indeed.
Yeah, I think that's really the hope, right, for this series of discussions, is to give people some tools that they can use to kind of keep their business going.
Yes.
Any other comments, or a couple other? Jonathan, George? George is asleep.
And you just woke me up. What the heck? There are a couple things, but I mean, you and I can go over them later. I think
Sure.
it's important to address legal issues. I think legal issues are very important for the business. So that's something
To add. Yep.
you know I want to address. We also have a lawyer that we could consult and get her input on some of this.
Oh, that's a good idea.
Yeah, so I think that's important. Let's see. I mean, I have some other notes, but I mean, that's the main one. I think legal is important. I also think one other thing is that the businesses need to reevaluate their healthcare plans that they're offering, and they need to include other kinds of things that deal with all of the secondary issues that, see, the thing is, it's not just this virus, it's other things that may come down the pipe. It's the secondary conditions that put people at risk, their weight, diabetes, other things like that. So they have to take a look at the health plans that they are offering their employees to see whether or not there's ways to help them address those issues. So I think healthcare plans, the types of benefits that are offered, need to be evaluated and changed for learning.
Pay people to lose weight, right?
Well, it's that, and it's also because of the forced social distancing, or let's say isolationism. Because remember, even if you put a piece of plastic between people, it's not the same. It breaks
Right.
the connection. And people are going to be suffering from a lot more mental
issues, yeah.
and depression and things like that. The healthcare plans have to be augmented to support that. And you have to train your staff and be in touch with them enough, the people on whatever your team may be, to identify those risk factors. That's, I believe, is going to be something that people aren't as used to dealing with, because we already see that there's an increase of almost, I mean, I don't know, people have different numbers, but it at least has gone up 300%. Some say as high as 600%.
Of like mental health.
Like mental health issues, suicide, all of those things are exponential.
Well, and then there are other indicators like domestic abuse and things like that, right? Those indicators are very clear.
Yes.
They're very clear on something as crude as a Google Trend search.
Yes, and so we just want to make sure
it's real.
Yeah, so the business needs to not necessarily get involved, but they need to train their people to be aware that these things may become more prevalent, and then how to handle them in a way that's safe. Lowe's, for example, isn't, Lowe's has a mask requirement, but they aren't having their employees enforce it. And there was some debate about it, but we've heard this from people who have security guards.
Mm-hmm.
If somebody comes and vandalizes the building, they don't have their security guards go stop them.
Yeah.
It's too dangerous.
No. It's the mall cop liability issue.
Yes. So I think those are some of the things that these are little extra pieces that need to be considered. That would be.
No, that's great.
The items I'd bring up. So those are the main ones.
Yeah.
Now I can go back to sleep.
Yeah.
That's great advice, actually. Those good points.
This is super critical what George's bringing up. Yeah, no, this turned out to be more of a friends session, but that's kind of good because I felt I was a little rough on delivery, and this is going to offer me a chance to improve that.
Well, we might be able to say we're all a little rough on delivery for tonight. So
Mhm.
improvements all the way around.
Yeah, and I might also say, from my perspective, again, perhaps it's good that we were a smaller group in this regard because we were all trying it out to see how the presentation went, what was of interest in that. And I think the feedback and further discussion amongst us will just hone that even more so. So I frankly, would have been wonderful if we had a lot of people, but it allowed us to feel a little bit more comfortable in just participating for this first time out.
Yep, I think so. Great.
Yeah.
Yeah.
Zahir, is there anything we can do to be supportive of you at this point?
Just you know, maybe I know it's a lot of info. If you guys could just take a day or two to digest and then maybe shoot me a note if things come to mind, I would appreciate that very much. You know, George and I are gonna find a time to kind of I hate to use the phrase, but I use it a lot. Do a post-mortem. Uh, an ARR, after action, or AIR, after action review. Let's call it that instead. Yeah, you know, we'll go over things, tweak this. But you know, have your thoughts, and also, if you're hearing questions that people are asking, that may be another thing to do. Like, and just moving forward, some feedback on the marketing. I don't know that I saw anything on LinkedIn, but what I would like to do is that with you guys' permission for the next one, what I think I'm going to do is I'm going to post it a couple times with a couple different questions. LinkedIn lets you post a poll, and that could be fun. It could help us get some info and also create some engagement.
I think that's a great idea. A little bit in the way of apology. I think that there was a sort of not a misunderstanding so much, but my assumption was that Justin was going to handle the LinkedIn side, and that was not his assumption. But
it's okay.
I know,
I mean, we were figuring it out.
It is okay, and that's what I'm not trying to point a finger. I'm just saying we went oops like this, and so for the next time, definitely, I think using LinkedIn more effectively, and I like the idea of polling. We can surely do that. That was just kind of an
yeah. Yeah, but it might help us get a pulse of what's going on in the community a little bit, doing the poll.
So, so I appreciate hearing that, and believe me, we can work on that and take care of it.
All right, great.
And